to deliver excellent patient care here locally through compassion, excellence, innovation.
We are now looking into innovation and research. We look into the patient as a holistic measure.
Bridging basic scientific research into the bedside.
It helped me so much that I can believe in myself.
The Organ Transplant Center at King Faisal Specialist Hospital is a comprehensive transplant center which covers all involved solid organs. We are offering all types of transplants and providing the highest possible standard of care by a team approach that all involved stakeholders are under one umbrella in the Organ Transplant Center and caring about the patient. The mission of the Organ Transplant Center is first of all to provide a proper access to organ replacement and organ transplant for the Saudi population. Number two, to provide the highest standard of care with the best outcome possible. And number three is to come up with research to innovate the field. We can offer now to almost all patients minimal invasive surgery. This means that the organ transplant will be done with minimum incisions, and this results in a faster recovery and shorter in-hospital stay, less pain and less complications.
Good morning, Wafa. How are you today?
We truly strive to give each patient a personalized patient journey. So we take care of the patients from the medical and also supporting services. We do provide psychology support, nutritional support, patient education support. We try to involve the patients and their families in the journey by explaining what is the timeline expected, what are the procedures needed, who are the stakeholders that are involved within the hospital or outside organization. We treat the patients here in the hospital after the transplantation for lifelong. One of our newest protocol, what we included in our routine clinical work is called Pharmacogenomics.
Because our genetic code is different, we want to know when we administer medications such as immunosuppressive medications that carry with them significant side effects and toxicity, whether the patient's genomic and genetic code will make them more suitable for certain medications than the others, and whether certain doses are more appropriate for them. And that's why we have translated the use of the pharmacogenomics to guide us on the right medication, the right dose for the right patient. We have access to state-of-the-art genomics center, multi-omics platforms, rapid diagnostic tests. So we are at a good position to translate the discoveries at the bench side to the bedside, and we can drive good research that will ultimately improve the patient's care.
As a pre-transplant workup, as a coordinator, we have a major role to ensure that all medical workup are completed. Officially, patient presented to our selection committee meeting, and officially patient adding to our acting waiting list. Further that, we have to update and maintain our acting waiting list, sharing our waiting list with Saudi Center for Organ Transplantation to receive an offer from deceased donor. We are having a major role to connecting all multidisciplinary team together. We are aiming together to provide the best health care for our patients, their donors and their families.
Our lung health center is the only lung center in the region where the medical and surgical teams, they work together to provide a comprehensive care to take care of patients with advanced lung diseases. We provide specialized care through the lung transplant program, but also other programs like pulmonary hypertension, cystic fibrosis, exercise physiology, and pulmonary rehabilitation. We provide multidisciplinary care through integrating multiple services before and after lung transplantation, in addition to clinical pharmacy, along with pharmacogenomics testing to support personalized medicine.
We founded the metabolic unit in the Organ Transplant Center as a pioneer center here. The metabolic unit's goal and core values is to look into the patient as a holistic measure. Not only we excel in the surgical field in the transplant area, however, we are now looking into innovation and research in these patients who have high risk morbidity and mortality of these patients are mainly known to be cardiovascular related. Metabolic diseases is a high risk in these population, and this is where we work to look into these clinics and make sure we work the patient and monitor them.
My journey was hard, seeing my mother struggling of pain, and I didn't even can do anything. When I received a call from my dad, he asked me, "Are you able to give your mother some of your liver?" I said yes, without even hesitate one minute. When I came here, first of all, I was so stressed. I was afraid. They offered me a physical therapist. They talked to me that they remove all the stress, and I was ready for the surgery. My recovery was very easy. First day when I got off the hospital, they kept calling me, asked me if I need anything. They came to my house and gave me some medicines and all of that.
Future aspiration is that we are reaching a high number of patients who benefit from minimum invasive access to transplant. And then our other dream is that we are inducing tolerance. Second vision is that to increase the available organs. And one of the now new options on the horizon is xenotransplantation. And this is also our dream that we will one day transplant, maybe as a routine, organs from animals.